Okay, this is just a quick video. People ask me, how do you rate your fitness? How do you know if you're doing okay? And a lot of, regular patients tend to be pretty ignorant about health, and they always want screening studies. And I can tell you, I've been involved in screening studies for over 30 years. I would never, ever do an imaging screening test. The reason is there's too many false positives. A false positive means they find something that really doesn't matter, an incidentaloma, a turtle cancer, or something like that. And then you get all this workup and follow-up and potential biopsies and surgeries that you don't need. So a turtle cancer is one that grows so slow, you would have died of something else and you don't want to know about it. Okay, so that's the reason why I'm not a big fan of screening studies. Things like lung cancer screening, because there's too much of a chance they're going to find too small to characterize lesion in the liver. And it's really just a cyst, but because of the low-dose technique on the CT, it has noise inside of it they can't tell. They might just get a follow-up ultrasound, but they might send you for an MRI with IV contrast. Same thing for a kidney lesion, etc. So I'm not a big fan of that. So I'm going to talk about simple things you can do for free and then a few blood tests. First of all, just look at yourself in the mirror. Do you look good? I'm 63. I'm 5'9". I weigh 158 pounds. I'm skinny. I weigh the same as I did when I was in high school. And, if you look good, that's a good sign, how much you weigh, what's your body mass index, weigh yourself, only once a week is more than, I haven't weighed myself in, about 6 months, but actually I weighed myself just a couple days ago, but before that it had been over 6 months. Saturday morning after you void, it's a good time to weigh yourself. How's your ability to sleep? You need to get that optimized. That's a big deal, being able to sleep. How's your energy level? You can kind of tell. And that is affected by your sleep, of course. How's your endurance? See how fast you can go up 10, 15 flights of stairs. That's a pretty good indicator of your health level. Go on a treadmill. Like I walk on a treadmill and I read, and I can tell how I'm doing it's pretty obvious. You set the speed, you set the duration. Like today, I walked a little bit over 7 miles while I was reading. I'm reading about the history of France right now, okay? And I love doing that because it motivates me to get my exercise and get my reading in. It'd be too boring to walk on a treadmill without a book to read. But I also know you build up adenosine chemical in your brain when you exercise, which is what causes sleep drive, so you sleep a lot better. But your endurance level by a nice performance thing you can standardize. How fast you can go upstairs, how fast you can walk on a treadmill, how fast you can run on a track. And what I'm getting at here also is you want to push yourself. I like to push myself a couple times a week, but you should push yourself, challenge yourself at least once a week so you know if you're getting better or getting worse. Same thing for lifting weights. I keep track of my numbers. I had been out of exercise for, I wasn't doing any intense exercise for a couple months because I had a problem with my eye and I was off the charts busy with work and some personal stuff. I'm helping out for some of my relatives. So I started lifting weights again, and my push-ups had gone down, but they're coming back up. I can do 57 good push-ups. When I'm doing curls for the girls, I can curl 70 pounds for 22 reps. That's where my strength is at a body weight of 158 pounds. When I do chin pulls, I can do 38 reps with 200 pounds. So for me, I'm not anywhere near my best, but I'm moving back up again. Okay, so I always keep a track of my training journal. I tape it to the mirror in my bathroom to know how I'm doing. Your ability to concentrate. Can you concentrate well? Can you read well on a treadmill? Can you concentrate well while you're working? Can you concentrate well while you're, watching YouTube videos? Whatever. Your concentration level when you're conversing with other people. Okay, how's your blood pressure? That's a good thing. Always check your blood pressure at least twice. The first reading is always going to be a little high. Sit in a seat with your feet on the ground. Don't talk for a couple of minutes before you measure it. The second or the third reading is always going to be lower. Make sure the cuff fits the right size. Blood pressure. Total cholesterol. I like to know my total cholesterol. I don't routinely check high sensitivity C-reactive protein, CRP. I don't routinely check lipoprotein little a. You can if you want. My attitude is, the people who eat low-fat vegan, they almost never have a problem. I'll just do that. And I know from past experience, my cholesterol bounces around from about 90 to about 140. I'm not worried about it, okay? I've been real happy with it. Serum ferritin, I checked that because I was a little high in the past. I was always in the normal range, but when I was a kid, I used to eat tons of Raisin Bran cereal because I thought the extra iron was good for me. Now I know it's stupid. And ideally, I'd like my serum ferritin about 30 to 80. Last time I checked, it was 110. It had previously been, I think, like around 290, which is in the normal range, but I want it optimal. Optimal is like about 30 to 80. Check your vision. How good is your vision? Can you see well while you're reading? Can you see well while you're driving? If not, you maybe check your glasses or ask yourself why that is. Glomerular filtration rate, you could check it if you want. Maybe check it once every 5 years, more often if you're having a problem, but how well is your kidney function? Okay. Hemoglobin A1C, you don't need to check it unless you're worried about potentially having diabetes. CBC, complete blood count, hemoglobin, are you anemic or not? White blood cell count, is your white blood cell count high? Because there's chronic low-grade inflammation of some sort. TFTs, thyroid function. So I'm not recommending you routinely check these. I'm just telling you, if you're not feeling well, these are some of the first things I would check. TFTs, thyroid function tests. LFTs, especially for a woman, TFTs. Liver function tests, LFTs. Tons of people got fatty liver. But what I would do is just avoid the things that cause fatty liver. Testosterone level, potentially for some guys. Toxin exposure. Now that gets into diet and water. Filter your water with reverse osmosis. Eat organic only, low-fat, whole plant foods. No oils, no artificial sweeteners. So anyways, this is what I usually go by. I try to avoid getting these other things. I mean, don't get me wrong. I will check my serum ferritin. I will check my total cholesterol. I like getting my blood pressure checked. But these are just some of the most common labs I would check. And then there's the whole B12. We're not going to get into B12. I made other videos about it, and that is like one of the most controversial things, and I haven't completely figured that one out yet. So I haven't completely abandoned it yet, but I do think it's overrated. But I don't want to come down firm on anything because there's so much contradictory information about B12. You really have to devote, probably a couple months of study to it before you'll be comfortable with what you come up with. Anyways, I hope you found this helpful.